all at the newly renovated pavilion in downtown Fernandina Beach. More info at ameliaisland.com/songwritersfestival. Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or baptistjax.com. The North Florida TPO is committed to shaping our transportation future. We're focused on planning, funding, clean fuels, and new technologies for a vibrant, connected community. Learn more at northfloridatpo.com.
This is WJCT News 89.9 Jacksonville. Up next, national and local news from NPR and the WJCT News team.
Good morning and welcome to First Coast Connect. I'm Al Emmerich, sitting in for host Ann Schindler. Today, connecting the uninsured to healthcare. We examine a city program that aims to use telehealth to reach more and reduce costs. Then, the architect of a new app explains how it helps young kids overcome neurodisorders and learning disabilities. And fresh off his tour with Howie Mandel, we catch up with Jacksonville comedian Danny Johnson. Join the conversation by giving us a call at 904-549-2937. You can also email firstcoastconnect@wjct.org or tag us on social. It's all ahead this hour after the day's news.
Live from NPR News in Washington, I'm Corva Coleman. For the first time in weeks, Venezuela has accepted a flight of migrants deported from the U.S. The Trump administration has pressured Venezuelan leader Nicolas Maduro to resume the deportation flights. NPR's Carrie Kahn reports the first flight landed in Caracas early this morning.
The Venezuelan deportees were first sent to a U.S. military base in Honduras, where a Venezuelan airline picked them up for the rest of the trip to Caracas. Direct deportation flights have yet to begin, but this was the first time in weeks that Venezuela has accepted the return of its citizens. Maduro had stopped receiving deportees after President Trump pulled a license allowing Chevron Oil to work in Venezuela. Trump then sent more than 200 Venezuelans to a maximum security prison in El Salvador. U.S. officials also threatened more sanctions against the South American country. Maduro has accused Trump and El Salvador's president of kidnapping the Venezuelan deportees and demands their return. Carrie Kahn, NPR News, Rio de Janeiro.
U.S. and Russian officials are supposed to open fresh talks today in Saudi Arabia about ending Russia's war in Ukraine. A U.S. team met Ukrainian officials yesterday in Saudi Arabia. Both Ukraine and Russia have agreed in principle to a partial ceasefire, but NPR's Eleanor Beardsley says it's not clear when that might take effect.
Ukrainian President Volodymyr Zelensky wants to broaden the ceasefire to include other infrastructure. He spoke last night. Here he is.
Потрібно також більше тиску на Росію.
And he basically says, everybody, the U.S., Europe, the world needs to put more pressure on Russia to stop this terror. And Zelensky said after the last meetings in Saudi Arabia, where Russian President Vladimir Putin would only agree to stop targeting energy infrastructure, that it should be clear to everyone that Russia is the only one who's dragging out this war.
NPR's Eleanor Beardsley reporting. The U.S. Supreme Court will hear arguments today over Louisiana's congressional map. At issue is whether the map was unconstitutionally drawn to create the state's second majority black district. From the Gulf States newsroom, Stephen Bisaha has more.
States can consider race as they draw their maps. In fact, federal judges in recent years have ruled it necessary to comply with the Voting Rights Act and give black voters more power in states like Alabama. That shift in congressional lines is part of the reason why the Republican majority in Congress is as narrow as it is right now. Louisiana's governor approved its new congressional map in 2024 and created a second majority black district to better reflect the state's demographics. But a lower court ruled the consideration of race in drawing the map went too far and declared it unconstitutional and racial gerrymandering. If the Supreme Court agrees with the lower court, that could further weaken the Voting Rights Act, and a new map will have to be drawn in Louisiana. For NPR News, I'm Stephen Bisaha.
On Wall Street and stock future trading, Dow futures are higher. This is NPR.
You're listening to WJCT News 89.9 in Jacksonville. Good morning, I'm Stephen Ponson. It's 9:04. The search for the two remaining missing boaters in the St. Johns River continues. Officials say a boat capsized in the river near the Dames Point Bridge late Friday with 8 people on board. Initially, crews rescued 4 people. One of the boaters passed away, and the Jacksonville Sheriff's Office says they've recovered one of the remaining missing boaters. No one on board was wearing life jackets. An investigation into what caused the boat to flip is ongoing. Kool and the Gang, Spyro Gyra, and Janelle Monáe will be paying visits to the River City in May. WJCT News 89.9's Michelle Coram has more on the Jacksonville Jazz Festival lineup.
Genre-blending artists like Mesa and other jazz icons will be here for a Memorial Day weekend of performances by award-winning artists. This year's festival is moving to Tailgater's parking lot on Talleyrand Avenue due to anticipated larger crowds and former festival sites like Metropolitan Park and the stadium being mired in construction. The schedule includes Mesa, Spyro Gyra, and Kool and the Gang on Friday, May 23rd, Janelle Monáe, Tank and the Bongas, Trombone Shorty, and Orleans Avenue on Saturday, and Branford Marsalis Quartet, Boney James, and The Roots Sunday. The 4-day festival is free, but if you want a bit of comfort and respite from the heat, consider purchasing a VIP ticket at JacksonvilleJazzFest.com. Michelle Coram, WJCT News 89.9.
Rain in the forecast in Jacksonville this afternoon.
Support for NPR comes from NPR stations. Other contributors include Cigna Healthcare, a health benefits provider that advocates for better health through every stage of life. Learn more at Cigna.com. And listeners like you who donate to this NPR station.
Support for First Coast Connect is provided in part by Baptist Health and North Florida TPO.
Good morning. I'm Al Emmerich in for Ann Schindler, and this is First Coast Connect. Today, curbing unnecessary emergency room visits. A public and private partnership cuts healthcare costs by connecting uninsured patients to medical treatment. Later in the program, we talk brain science and cutting-edge approaches that are making dramatic breakthroughs for children with dyslexia and other cognitive learning disorders. But first, for many Jacksonville residents who lack health insurance, navigating the healthcare system can be a stressful and costly burden, no doubt. And there is a new program that aims to connect the uninsured to primary care and non-emergency medical services. I am joined this morning by Paul Sapia, Chief Population Health Officer with Telescope Health. Good morning, Paul.
Good morning, Al.
And also joining us, Dr. Sunil Joshi, Chief Medical Officer with the City of Jacksonville. Good morning and welcome to you, Dr. Joshi.
Good morning, Al. Good morning, Paul.
Good
to see you
morning,
both.
Dr. Joshi.
So I'm going to start with you, Dr. Joshi. For those that may not have heard about the program yet, obviously it was in the headlines a great deal over the previous months. What is Healthlink Jax and why was it created?
Well, so Healthlink Jax basically is this unique and innovative way for us to provide healthcare to folks who don't have health insurance and to divert them away from the emergency room and into a primary preventative care setting. And so we learned that this was truly a need in our community as the City Council put through a critical quality of life issues task force a few years ago. And as the mayor was coming into office, she had transition committees put into place. And in our health access transition committee, this was one of the big points that came up, is that people are utilizing the emergency room as a source of primary care and not really getting into the primary preventative care that keeps them healthy in the first place. So we started looking at ways to come up with an innovative way in order to address this need, in particular for uninsured patients. And it's been an amazing success in such a short period of time.
Yeah, anybody who's ever said, I have to go to the emergency room, has preceded that with, do I really need to go to the emergency room? Because that's a long wait. So I have to also believe that, and we'll break this down a little bit further with Paul as well, but that this really is about alleviating some of those pressures in those ERs, correct?
Oh, that is 100% true. And so, and also, if you talk to some of our not-for-profit clinics in town that take care of folks who don't have health insurance, and they survey their patients as they come through, about 76% of those patients admit that they've gone to the emergency room between 1 and 3 times in the previous year before they were set up with a primary care provider. And of those 76%, almost 50% of them admitted that they went to the ER for a minor illness. So again, if we can keep these folks out of the ER and in preventative healthcare, not only are we providing them healthcare the right way by preventing illness, we're also keeping our emergency rooms from being overburdened with folks who may not need to be there to begin with.
It's all in the data, and obviously there's a number of benchmarks that are far beyond our pay grade in this short period of time we have here. But just give us a sense, Dr. Joshi, how many people are uninsured in Jacksonville, and what typically are the reasons that people are uninsured? I think there's some misconceptions around that.
Right, right. And not all uninsured people are uninsured because they're indigent. You know, some folks are self-employed, and health insurance is very, very expensive. And so going into this administration, we knew that there's approximately 120,000 people uninsured. That number is now somewhere around 100,000 folks in Duval County that are uninsured. Our Get Covered Jax program has kind of tried to highlight the importance of Affordable Care Act insurance and the fact that there are ways to get some pretty good health insurance plans at relatively low premiums if you have somebody help you navigate through the system. So we're looking at right around 100,000 people, about 10% of our population that is uninsured.
The correlation between health outcomes and how that affects communities has been a long-standing debate and conversation and dialogue. How do poor health outcomes for some affect communities as a whole? What could we grasp that to understand?
Yeah, I mean, I think it's important to realize that, you know, when you look at health outcomes and you compare counties to different counties in the state, for instance, it does impact us as a whole in a lot of reasons. So for one, a lot of the indigent population or uninsured population tend to be the ones that typically are underserved and are the ones that typically don't have a primary care provider and utilize the emergency room as their source of primary care. And as a result of that, the taxpayers fund those not-for-profit hospitals who aren't able to receive compensation for the care that they're providing. So number one, that affects us from a tax base. Our tax dollars are going to those institutions to help fund uncompensated care for folks who are utilizing the emergency room without health insurance. So that is one way that affects the entire community. But also, you know, health outcomes are ranked throughout the state and throughout the country. And if your community tends to have lower health outcomes, that does make it a little bit more difficult for large companies to relocate if they're thinking of, my goodness, this community has worse health outcomes than a competing community. So we all win as we improve health outcomes in Duval County. And I think it's important to also remember 842 square miles. There are parts of Jacksonville, Duval County, that have fantastic health outcomes that would rank them in the top 20 of countries in the United States if those health zones were countries. But then we have other parts of our community where if those health zones were countries, they would rank in the 160s, 170s in the world in terms of overall health outcomes. And so we have a very diverse, very, very much spread out community. And of course, focusing on the areas in town where we have the worst health outcomes can improve health outcomes for our entire region.
It's such a dichotomy. When I travel across the country, people will speak about Jacksonville and say, "Wow, you guys have such a great system there." And yet when they think about Jacksonville or talk about the health of Jacksonville, it sometimes has a negative flair because we are so dispersed and so rural. But you know, that's why Telescope Health was in part created. Paul, tell us first of all, what is Telescope Health and the service that it provides, and then we'll get into the relationship with the city.
Yeah, absolutely, Al. So Telescope Health is a data analytics and telemedicine company. So we work with accountable care organizations, physician practices, hospital systems, health plans to really engage patients in their health. And so if you think about a standard telemedicine company, it's an episodic piece of the puzzle, right? It becomes standalone. It happens and never gets back to your primary care physician. So we work with all of these organizations to kind of create a unified system where if a patient is seen in telemedicine, that note gets back to their primary care so that they know that there was an issue, they know something happened, and what the physician that saw them prescribed. So we've taken that same piece of the puzzle and brought it here to the uninsured population here in Jacksonville. So we are a physician-owned company, started here in Jacksonville, really looking at the basis was the emergency room was seeing a lot of patients that didn't need to be there. So how could we create an emergency room access point for patients without having to go to the emergency room? So we're staffed by emergency room physicians. It's a virtual medicine company, but we also have a nurse navigation component. So we can bring in, get patients connected to a primary care or other resources that they need within the community.
So it's really kind of a loop versus a disconnect, meaning they come in and then it's gone and there's no way to track it.
Absolutely.
So what are the types of non-emergency conditions, you guys traditionally?
A cold, common cold, bronchitis, UTIs, we can see those, dermatitis, those type of dermatological issues. We can see a lot of those type of things. We can also just connect patients, right? A lot of times patients are lost. My head's been hurting for 3 or 4 days. I'm not really sure. Do I need to go to the emergency room? Do I need to go to the doctor? What do I do? And if you don't have insurance, that becomes even tougher because now your where you can go is limited, right? If you have insurance, you've got a network of providers. You can go to the primary care physician. If you're uninsured, you have one option. That's the emergency room.
Mm-hmm.
And you're going to end up in the emergency room. And it could be something you're just dehydrated, right? And you've got no other issues. So something like that our primary care physician or our emergency room physician or nurses on for the virtual care, they can actually get you to where you need to go in the right place.
Dr. Joshi, having myself worked for about 6 years in the emergency medicine and hospitalist medicine field, in the earlier days when telehealth was just first starting to kind of peer its head into the public domain. And I know that there's sometimes a concern among patients and the public, well, can I really get the type of care? You're a clinician, chief medical officer for the city of Jacksonville, obviously stewarding this project and this program. What do you say to even somebody that's uninsured that has doubts about, hey, is this telemedicine? Does that really work? Can that work for me?
Right. And that's a great question too, because we struggle with that in practice all the time, is that how do you adequately take care of a patient if you're not getting their vitals and things of that sort? And so where this really works is for those minor illnesses, as Paul was discussing, somebody who might have an upper respiratory infection, bronchitis, sinusitis, urinary tract infection, back pain, cellulitis, a skin infection, these types of things where the history, talking to the patient gives you a lot of information. And yes, you can't touch the patient, you can't do the vital signs, but you can at least help the patient virtually for those conditions. Now, again, if it gets to the point where it doesn't seem like we're able to get enough information just virtually through communication, that's when the patient does need to go to the emergency room and or go in to see a primary care provider the next day or even later that day. And that's something that the physician on the other end of the phone, the other end of the virtual visit, can recommend and try to set up for the patient as well. So this is really a way to get those folks who otherwise really can be handled virtually to be handled that way, as opposed to going to the emergency room for those types of services.
Well, I don't think you can underscore enough to the naysayer who may be insured and be a skeptic. I think the impact they're going to see not only in the quality of care increasing because there's less overutilization. So with that being the case, you launched fall of last year. Dr. Joshi, what's been the impact of the program thus far?
Yeah, it's amazing. So, by the time we actually kicked off the program with a press conference and all of that in middle of August of 2024, that's only been about 5 months, 6 months since we started. And in those 6 months, Healthlink Jax has touched about 1,500 different people, whether it was through direct physician contact or through social services or through the nursing care management team, and have kept about 900 to 1,000 folks out of the emergency room. with a financial impact of about $3.8 million. So by keeping those 900 people out of the emergency room, where each emergency room visit, uncompensated emergency room visit, costs about $4,000, you're looking at a $3.6 to $3.8 million impact here in Duval County, just simply by having this program in place for the last 6 months. And so, again, we feel very excited that the future is going to be great for this program as we go forward, and especially as the word gets out. And it'll start to save, the emergency rooms in hospitals from uncompensated care, and they'll be able to see patients much more efficiently and get paid for them as well.
Yeah, and this is taking advantage of not just the technological opportunities and the quality of that exists in that technology, but really expanding the brain power of these clinicians who can now serve more.
Yeah. And one thing I do want to point out, so Dr. Joshi mentioned, the emergency room physician seeing, we also have nurse navigators,
Okay.
right? So we've had a lot of patients call, like we had a patient call looking for diabetic needles. Couldn't afford the ones that she could find. They were $65. She was able to talk to one of our nurses. We were able to navigate her to a place to get those needles for $15. And it was walking distance from her house. So that
Wow.
just saved her, having to go to the emergency room to get those because she was uninsured. She could afford the 15, but she couldn't afford 65. And so, those nurse navigators really take the time to understand what programs are available within the community and how we can steer patients. So somebody could call the number 904-925-CARE. And
What was that again, Paul?
904-925-CARE.
Nice job, Paul.
2273. And so the nurse can actually navigate somebody. Somebody has a question. Where do I go? What do I do? How do I get this medication?
Mhm.
And they can steer them to the right place to get it. And they never even have to see a doctor.
So I sometimes it's important to restate the obvious. For those of us that are insured and our insurance companies offer these services, which still are underutilized, by the way, that's what the data says. This is that same resource for the uninsured. If you're just joining us, we are talking about a partnership between the city of Jacksonville and Telescope Health that provides free telehealth services to Duval County's uninsured. And there are more than you realize. You can join the conversation if you'd like to by calling 904-549-2937. You can also email firstcoastconnect@wjct.org or reach out to us on social media. Dr. Joshi, how does Healthlink Jacksonville speak to the importance of the mayor's vision of this public and private partnership? And is this maybe a model for other programs?
Oh, 100%. And so this is truly the epitome of a public-private, not-for-profit partnership. So City of Jacksonville, Telescope Health as our private partner, and then a lot of our not-for-profit community health centers throughout Jacksonville. So through Jax Care Connect, which is where these patients, if they're diverted from the emergency room, do not have a primary care provider, our friends through Healthlink Jax will try to schedule them to have appointments through the Jax Care Connect system, which then connects them with 7 of our free and charitable clinics here in Duval County. And so this is a way for these folks to get that primary preventative care and to keep them out of the hospital going forward. And so when they do end up getting into the primary care system, remember we talked earlier that 76% of these folks utilize the emergency room between 1 and 3 times in the previous year. Once they've been in with one of these free and charitable clinics for a year, only 24% of those folks went back to the emergency rooms. That's a significant reduction in emergency room utilization. So a perfect public-private, not-for-profit partnership. And it's that collaboration that's going to allow us to do many other great things in medicine. We know that our Healthlink Jax team is now trying to work with mental health resources in our 988 system through the United Way, and we'll work with the pediatric providers as well. So again, we are collaborating in a way to improve health outcomes so that everybody wins.
All right, we only have another moment, real quickly, and Paul, what is the next step for Healthlink Jax with Telescope Health?
Yeah, absolutely. So I think it's, continuation of this program here in the city of Jacksonville. As Dr. Joshi stated, we've had a huge financial impact, but it's also a huge social impact. The patients that typically are underserved, that are not getting the care that they need, they now have an easy access point. It's a phone number you call, you get a live person on the phone. We send a text link to your phone, email to your device, and you're connected, right? So that's super easy, very, very impactful. The next step, hopefully, is to continue to build into the surrounding counties. There's a lot of people in Nassau, Clay, St. John's, that come into Jacksonville to work, that utilize our emergency room system. And so it's expanding out into there, and then continuing to use this, to highlight the innovative approach that Jacksonville has taken to address this population.
Dr. Joshi, we have just under a minute, so in 30 seconds, how does it feel to sit in the cockpit of this program, and what do you most want to tell the public?
Yeah, it's fantastic. And so, we continue to learn as we grow. And I think what's really important for the public to understand is that by providing healthcare, giving folks who otherwise don't have access to healthcare an opportunity to stay out of the emergency room and get the primary preventive care that a lot of us take for granted, really will impact health outcomes and make it easier for every citizen in this community to utilize the emergency room when they really need to, so they're not backed up with hospitals taking care of folks who don't really even need to be there. So this is a win for every single taxpayer in Duval County.
Fantastic. Paul, what is that number one more time in your radio voice?
904-925-2273 or 925-CARE.
Paul only has a radio voice. He's got the perfect radio voice.
My name is Paul Sapia. Paul Sapia, Dr. Sunil Joshi, excuse me. Thank you so much for being here, for taking the time. What an incredible program. Coming up next, how a new app based on decades of brain science is helping kids with dyslexia build stronger reading skills to mitigate and in many cases eliminate their struggle to learn and read. You know what? It is a Monday morning, and this is First Coast Connect. I love the morning groove of this show. I just play it over and over and over again. Well, welcome back to First Coast Connect. Millions of children struggle with learning to read. Often there's frustration, setbacks before they even start school, not just on an individual level, but for their families. And a groundbreaking new app developed by brain scientists and backed by decades of research is changing the game, literally and figuratively. Joining me to discuss the science behind early literacy, the impact of dyslexia, and how innovative technology is helping to prevent reading struggles before they actually start is Dr. Tim Conway, CEO of the Moore Center, Ponte Vedra Beach, and Karen Elliott, mother of 3 school-aged children and a proud fan. I welcome you both to First Coast Connect this morning.
Thank you. Thank you so much.
You are very, very welcome. Dr. Conway, let's start with you. You are a world-renowned expert in dyslexia. First of all, before we bust into this, just give us the poor man's version of dyslexia. What is it defined as?
It really just means you have one of 3 troubles, either poor reading accuracy, poor reading speed, or poor reading comprehension. And it doesn't mean you see things backwards. That's what the media keeps putting out there on TV shows and on the simulations on the computer. It's not a visual problem. It's a difficulty in being able to sound out words.
All right. And now neurodevelopmental disorders. We went from like 2 lanes to 20 lanes of traffic, it seems, in the last 5 to 10 years with neurodiversity. And so help us also now understand the definition of neurodevelopmental disorders.
It just means difficulties that are genetic. We get to tell kids, hey, if you have trouble reading, you know who you can blame? The kids are like, no. I'm like, it's mom or dad. He said, but you know who they can blame? It's grandma or grandpa. Don't worry about it. Just family genetics. And that genetics gives you a predisposition that you're either going to be strong or something or weak in something. Yeah. And the good news is we find the weaknesses, we can make them stronger.
Now, I have the luxury of having met you, watched you in action, seen you, watched your videos. You are passionate, and you're a technician. You're I'm sure near genius level, whatever your IQ is.
I know that.
You know, but there's a passion driving this, and tell us a little bit about that, because that is so much the embodiment of your work.
100%. You have to understand, Al, that I'm second generation of doing this. My aunt and uncle were world famous for their work in dyslexia. Mm-hmm. And thank goodness, because dyslexia, it doesn't run in my family, it gallops. So I'm dyslexic, but I got prevention at age 5. So because of that, I've never struggled to read and spell. And then fast forward a few decades, I have 2 children. Both of them got my genetics. Both of them got dyslexia as well. So lucky me, lucky them, we don't struggle. My kids actually excelled through school, went to advanced placement high school positions, and both went to university on scholarships. Every parent's dream. But what about all the other kids? What about all the other kids who may not have access to those early services? And that's why we've been building the companies. We built nowprograms.com as an ed tech online to deliver services around the world. And now we've got Lip Letterland, the app that can actually help 3, 4, 5, and 6-year-olds not struggle.
And I want to pause you there. We could do 7 hours on the incredible programs and work you've done. Today's focus is really about Lip Letterland. But Karen, I want to first ask you, how did you come to meet Dr. Morris and Dr. Conway and the Morris Centers?
So, ironically, I was online. I was an educator first, and my children were having struggles. Biggest one was my son. He wasn't able to read, and I'd done everything I could to help him as an educator, a special educator at that. And when you go to school and you learn about teaching, dyslexia comes up, but you don't spend a lot of time on it. How to remediate it, how to intervene. I'm not one to want to, help a kid. I want to close gaps.
Yeah.
And I wasn't able to find a program that would allow me to close the gap for my kid. I was searching online at all these programs, and none of them had any kind of studies or research behind them. Nothing scientific, but just, this program is evidence-based or research-based. Well, show me the research, and I couldn't find it. I joined every group possible. And I ran across somebody who just said Now Programs, Morris Center, and I started researching. Guess what I found?
So as you're doing this research, because I want to speak to the parents that may be listening right now, and they're in that void. They're in that gap, right? Mm-hmm. And we talked about the traffic. Am I to understand that amid all of these different quote unquote searches, you didn't find this gap? Why do you think that was?
Didn't exist. Like, there was not research sitting there to show me that if I put these children in a group and I give them this reading program, they're absolutely going to make gains. I wasn't finding that until I found this program. I could actually see a study that had been done that was randomized and controlled, and maybe it's because I'm a sociology major. I wanted to see data and study.
Yeah.
And I was able to find it. And I said, well, the worst thing that could happen is I try it and it doesn't work. But according to the study, it should.
All right. So obviously I'm with 2 people who have excessively done their homework, which makes me feel so in right field because I never did my homework as a kid. But I struggled. And in reading and listening to what you've created, wow, I wish that was around when I was a kid.
Right.
But you really have attacked these issues from 3 different approaches. So tell us about, you've got the Morris Center, the Now Programs, and the Einstein School. And of course, we're going to talk about Lip Letterland.
Sure.
Amazing. But what are those projects and what unites them?
So the Morris Center opened in 1986, and it's a developmental team of experts in speech pathology, the language experts, OT, the sensory motor, attention regulation experts, psychology, the mood behavior experts, who are all cross-trained together. And I joined the Morris Center in 1989, right out of undergrad. And so then we started doing research, and we published 3 5-year, what are called randomized controlled trial research studies. Best way to explain that is to say that's the science that built penicillin, and pretty much any medication or any medical treatment comes from that caliber of research. The big famous Yale Center for Dyslexia has a pediatrician named Dr. Sally Shaywitz. She advocates that only randomized controlled trials, levels of research, gives parents the confidence to know, like Karen said, the program should work because we've got evidence and strong proof that it's going to work. So then we opened the Einstein School right after we published our first study, showing we could take kids from the 5th percentile in reading to the 45th percentile with even just a small dose of the instruction. That dose was no more than 80 hours, basically 8 weeks.
Wow.
Kids got 2 hours a day, 5 days a week for 8 weeks, and the average gain was from the 5th percentile in reading skills to the 45th, which means they're rock solid on grade level.
And over 8 weeks.
Yeah, that's it, just 8 weeks. But then the real measure of the effectiveness of a dyslexia intervention is what happens 1 year later, 2 years later. And we measured those data points with those 8 to 10-year-olds, and they kept getting stronger and stronger. So we opened the Einstein School as the very first free charter school in all of the United States, only for kids with dyslexia. And it's in Gainesville, Florida. It's been there for 25 years. I'm one of the founders, and I'm the president of the board as a voluntary board member. And every kid gets the services there for free. It's got 120 kids in grades 2 through 8. And our goal was maybe it's going to launch dissemination to other schools. But what most people don't understand is healthcare and education have one major difference. Healthcare has to be evidence-based as much by randomized controlled trials as possible. Education doesn't require that. Anybody can make up any program you want. If the school buys it, your kid's going to get it. And it doesn't have to have any proof that it actually works at all.
Is that really is that really at the core of what this what I'm hearing is that this is a deviation in a belief system of learn versus health. Is it really that simple?
It really is. Yeah. If you go back and study the history of physicians, you'll find out that early on, 1700s, you became a physician by finding somebody in town who thought they were a physician, and people thought they were a physician, and they would teach you what they thought was medicine.
Right.
We had really high mortality rates because a lot of them were wrong. The stuff they were doing was not effective. And then medicine got pushed into becoming evidence-based, and it gets better every year. Every decade it's stronger, better diagnosis, better treatments, better outcomes. But that standard does not exist in education.
Karen, I'd like to hark on what you said, which is, you're a sociologist by trade, correct? Okay. You obviously are invested personally. So before we get into a little bit more about Lip Letter Land, and also I'm going to open up the lines here in a moment for folks to call in with questions. But what is it you as a parent would want to share with other parents or family members or educators or practitioners? Because you've experienced this not once, twice, but with all 3 of your children, correct?
All 3.
Yeah. So just walk us very briefly through that journey of your experience with those 3 kids, and then what you want to share that you've learned from a data standpoint.
So when I say sociology, that's what I studied in college.
Okay.
But I've taught in public schools for a very long time.
Okay.
I'm not in the school systems any longer. My kids get all of me now. So for me, my journey was more so working in special education, working with children who are neurodiverse, and seeing them fail. I worked a lot with children who made a lot of gains. However, when you sit and you watch reading instruction done, knowing how teachers are taught to read, taught to teach reading. Yes, there are programs that teach you, but when you have a child that doesn't fit into the science of reading or whatever system it is, because they have this underlying neurological weakness, and you're not specifically trained in how to do that, and you're not using a program that's designed to close that gap for them, what happens? Their delay continues. Their confidence, where is it at? They lose it, right? And then school becomes too hard and they give up, right? I was seeing my children go through that. That's the long and short of it. My kid was in 1st grade being told, well, you should be able to do this. We showed you. And then, well, here's the word blue. Read it to me. We've been practicing it. Why can't you do that?
Wow.
And him saying, Mommy, I just need a bath. I'm just so sad. That's not how kids learn.
Yeah.
That's not what's okay. And to no fault, it's not the teacher's fault. no one's, out there trying to be mean to children, but children take in things different than we as adults do a lot of times. So I'm not mad at anyone or upset. But if you're not trained in this and you don't have something behind it to really show what's going to help them,
Yeah.
they're not going to get what they need. So, that was the story. And I choose my son because that was when it really became a big deal. My daughter was older. Hers was in comprehension. She took every test there was and couldn't pass it because she couldn't comprehend what she was reading.
Wow, that's just heartbreaking. I mean, as a parent, and even if you're not a parent, you know that pain. And shoot, I mean, I remember sitting in the classroom myself. I was able to verbalize, but framing things sometimes visually was just a nightmare for me. So, hey, listen, we have got some great conversation going on. We're about to unpack this incredible new app called Lip Letter Land. If you'd like to join us, please do so. You can call us at 904-549-2937. You can also email us at firstcoastconnect@wjct.org and participate in the conversation. So, Dr. Conway, Lip Letter Land. First of all, cool name. But what is this? And tell us what it works.
Well, this is an early literacy app that is to help children build the speech processing skills that you actually need before you get to the reading skills. Okay. Easy way to say it is everybody's brain learns how to speak first, and reading comes later on. The number one predictor of your reading skills has nothing to do with letters. It has to do with how well you can perceive sounds in words and judge sounds just being changed. It's kind of like saying you had friends who could do Pig Latin and you had friends who couldn't. Yeah. Well, the ones who couldn't do Pig Latin are struggling with that speech processing piece. They're actually more likely to struggle to read and spell too. So Lip Letterland is designed to build that neural processing of sounds that's part visual, it's part auditory, it's part your mouth movement, and it's part feeling where your mouth is touching. It's those four senses wiring together, what we call a six-way multisensory interactive app. So for 3 to 6 year olds, we want them to play the app with a parent or with a caregiver, someone who engages with them, and really get them checking about what they feel their mouth doing. Simplest way is to say, lots of kids mix up B's and D's.
Yeah.
Because it's kind of hard to remember visually, they look a lot alike. But no one taught them that, hey, if you make the sound buh, your lips come together, your lips pop apart, and we can make a name for that. We can call it a lip popper. But when you make the sound for the D and say duh, it's not your lips that's working, it's your tongue. We're going to call that one a tongue tapper. And your brain now has a more explicit way to differentiate those sounds because we taught you more details. That's what Lip Letterland is going to do. It's going to teach you lip poppers and tongue tappers and tongue coolers and skinny airs and fat airs and tongue lifters, just all kind of fun, crazy sounding names, but they strengthen that speech processor, and then they go to the letters later.
You realize, you talk about that, you are productizing an entire brand here with all those, I can see T-shirts with those names on them, I remember being with you once and you gave me a test.
Mm-hmm.
I'd love to share that test. I think
absolutely.
Yeah. What, and this would be pertinent to our listeners.
100%.
Because
it helps them know if their child's likely to struggle or not struggle. And it's actually a sensitive, reliable test. And as Karen brought out, it's been studied. We have big longitudinal studies. So basically it means they measured about 20 skills on 5-year-olds and repeated the same measurements at age 6, 7, 8, 9. The question was, what skill at age 4 or 5 predicted your reading skills at age 9? And it's this one task. We teach pediatricians to do this too at the 4-year-old well check. All they have to do is you say the word like cat, and you get your child to say it back to you. So Johnny says cat. You need to tell him, now Johnny, say cat again, but change it. Say cat, but don't say the k sound. Leave that off. And the Johnny who's not going to struggle to read and spell almost immediately just goes at. You give him a different word. You say flame. Johnny says flame. You say, now say flame. Don't say, oh, leave that out. And the Johnny who's not going to struggle to read just says fame almost immediately. You say baseball. He says baseball. You say, now say baseball. Don't say base. And he says ball. That's the predictor of your reading skills at age 4. It's called phoneme elision, which means sound takeaway. Can they take away a sound and put all the sounds back together?
So if I'm listening to this morning and I hear this and I go back to my child and I run this game,
yeah,
and they struggle, what should my action take? Is it I just go get Lip Letter Land and I'm good to go, or do I talk to my doctor? What is your thought on, or recommendation on the steps?
we have multiple options. That's part of our goal, is to create multiple pathways of information to parents.
Yeah.
One is, they can just try lip, letter, lang, 'cause it's only going to help. And even if your child does well with saying cat without the k sound, lip, letter, lang is still going to help as well. It's just going to make their system even stronger. So it makes the strong kids stronger. It makes the weak kids stronger as well. So it's really an app designed for all 3 to 6-year-olds to strengthen their pre-literacy skills. But if the child struggles with it, you have several options. One, you can go to nowprograms.com, click on a free consultation, and I've got a team of about 120 people, and they do free consultations all day long with nowprograms.com. Or we have the Morris Center in Ponte Vedra Beach. You can contact the Morris Center. They do free consultations at the Morris Center. Help understand what your child's struggles are, give you information about it. Or you can go to the websites. Nowprograms.com has more information. The morriscenter.com has more information. Or if you have your child has a speech pathologist because they're already working on some articulation, talk to your speech pathologist, talk to your pediatrician. Most likely, most pediatricians themselves don't have much training in language development. They know milestones. But it's a developmental behavioral pediatrician that's a specialty group who really understands language development. And some folks already have their kids seeing a developmental behavioral pediatrician, and they should be able to educate you even more about what are the language risks and what can you do to close the gap before it gets bigger. Because that's what Karen was talking about. When there's a gap at age 7, if you don't do the right interventions, it's going to be bigger at 8, bigger at 9, bigger at 10. It just keeps getting bigger.
Karen, what are the gaps that you see in other parents' ability to find an answer? I know you said from a data standpoint, there's nothing out there. But I have to also imagine there's a fear factor.
Huge.
Yes. Talk
Huge
about
fear
that.
factor. One, there's guilt. Like, why didn't I see this before? What did I miss? How did they get so far? There's so many things. Like my daughter, when she came to the Morris Center, she was 15 years old.
Wow.
I'm in education, special education.
Mm-hmm.
How the heck did I not know she had dyslexia? Like,
Yeah.
what? Right?
Mm-hmm.
Then I have a little one who's struggling, just couldn't read because, again, dyslexia is this big name that everybody hears, and it's, oh, you look in the mirror and they see things in reverse. That's what you hear, right? Or they write backwards. Well, guess what? That's not it. It could show up in comprehension. It can show up in math. It can show up just in all the things, right? And if school's just generally hard, that could be it. It could be this neurological deficit that they have that isn't a, learning disability per se, but just a weakness in phonological awareness, right? So, for me, as a parent, I would say it's the fear. It's, I don't even know where to look. What do I do? And then you have other parents, oh, just go try this program. Oh, just try this program. You don't know where to go to get the testing, or the testing costs $3,000 and insurance doesn't cover it. Or it's, okay, well, I'm just going to do the testing at school and let them tell me what to do. And they count on the school to remediate, but it doesn't close the gap.
Gotcha.
And most people don't know that schools typically don't diagnose. Schools do testing to actually categorize.
Right.
Do you qualify for this category of services? But if you truly want a diagnosis, you have to see a licensed neuropsychologist or a licensed speech pathologist. Many school psychologists are actually not licensed to practice outside of the school. So they actually don't have a license to diagnose. And schools don't want that liability.
Yeah.
So you really have to go out usually to the private sector to get a more thorough diagnosis.
You have to remember, the objective of a school is to help the children to access the current curriculum as it is. It's not to necessarily fully remediate. It's for access. So the goal, it all depends on what your goal as a parent and what your goal as an educator. Sometimes they're not the same. And I think that's where a lot of folks aren't understanding. Like, they're not a doctor. They're not there to help you per se cure it or remediate it. It's, they just want you to be able to access and get through the day. And that's why you hear how did they get there and graduate it? Well, because they were just accessing it.
This doesn't count anymore, but my uncle used to have a quote. He's like, you don't go to a gas station to get dinner. Now we can, thank you. But it's like, it's what is that utilization? And if you throw in, I would imagine, I'm not a teacher, but the under-resourcing and the other constraints and resources, it really leaves a lot in the gap. Speaking of the gap, we've got about another 10 minutes or so before we step on, or 5 minutes, maybe 7 minutes. I don't know. I can't tell time. And I'd like to blame it on my dyslexia, but I can't do that. I can tell time. If you'd like to join us, please do. Oh, 2 minutes. Wow, I was really off. That was terrible. They're just laughing at me. 904-549-2937 if you have any last quick question or comments. Comments like Alexandria on Facebook. Dr. Conway is the epitome of professional and human qualities. So you definitely have a fan club. We do have only about a minute and 30 now, so I want to give you both a chance to have some closing comments. First of all, you, Karen, what do you most want parents to know that would not have to suffer the pain you've suffered? Very, very briefly.
If I had known about Lip Letter Land, that's what my children would have played when they were little. I remember going on looking at apps and reviews, just trying to figure it out. But you got to remember, language comes first. They learn how to talk first, and this is kind of what it's getting at, is telling their brain what to do with their mouth, which my son says that's what the difference was between him learning this versus the other ways of reading, which made the difference for him. So I would say that. And if you can, get a consultation. Like, even if you don't do it, get a consultation and see for yourself what the difference is, because you won't regret it.
Okay.
My kid's in 7th grade now, flourishing, writing 5-paragraph essays and reading whatever book he wants.
Dr. Conway, we have 15 seconds. What do you most want to say to people about Lip Letter Land?
I want to say that it's for every kid to help empower their literacy strengths, and there's no reason not to try it, because everyone benefits from stronger literacy skills.
Dr. Tim Conway and Karen Elliott, thank you both so much for being here. Coming up next, from viral specials to touring with Howie Mandel, we meet a local comedian who is defining success and laughs on his own terms, and he is funny.
Terrell Hogan Law.
I'm Wayne Hogan. One texter call can wreck it all. Learn more through distracted driving presentations for teens and the workforce. Arrive alive. Let's end distracted driving.
More at TerrellHoganLaw.com.
Hi, it's Tom Hudson, host of the Florida Roundup on Fridays at noon, and we have a special edition soon. We'll be live in Jacksonville on April 4th. We'd love to have you there. It's free and lunch is included. Information and register at wjct.org/events.
I'm Ernest White II. I've traveled the world as host of my TV show Fly Brother, and I'm looking forward to returning to my hometown of Jacksonville and sharing these stories of friendship and the transformative power of travel with you. Join me at WJCT Studios Monday, April 7th for an evening of connecting, food, giveaways, and a sneak peek at Fly Brother Season 4. Go to wjct.org/events for more information about this free event. Let's fly.
Masayoshi Son is the most powerful tech mogul you've never heard of, and yet he's pouring billions into the U.S. and flexing his connections to the White House.
Mr. President, last month I came to celebrate your winning and promised that we will invest $100 billion. And you told me, oh, Masa, go for 200. Now I came back with 500.
That's on the next On Point.
Today at 11, here on WJCT News 89.9.
What exactly is an executive order? It's a question we received from so many of you. Like others before him, Donald Trump has signed dozens. But why do presidents have this power in the first place? We revisit our listener-suggested discussion on the history of executive orders, their role, and how well they work. That's next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Oh, yeah. Feel like I should be doing smoky jazz. I don't know. That just always feels good to do that.
It does. I like
Does that
it.
voice you like?
WJCT First Coast Connect, connecting you with what's most important on the First Coast. 65 degrees, partly cloudy, no traffic to be seen. Welcome back. Coming up next, after the comedian, we'll have a juggler, a fire spitter, a couple of little people.
I'm leaving the studio.
Right.
Yeah. Ladies and gentlemen, boys and girls, comedy has arrived in the studio. His name is Danny Johnson. In addition to being truly a dear friend, one of the toughest jobs around, and I admire him for that because comedy ain't no fun sometimes. Nope. And telling jokes is hard. And gosh, sometimes they land, sometimes they bomb. You've seen them all. We're going to talk about how it's been done, from your dry bar comedy special to with Howie, all that stuff. Yes. Ladies and gentlemen, Danny Johnson.
Good to be here.
Man,
I like, look,
yeah.
You go from telehealth to dyslexia
to you
to my dumb jokes.
There's a theme.
And I don't know. It's like, well, now we're in the mental. Is this the mental health part? You had the dyslexia and the telehealth. That's physical health, and then you got the mental issues. I like the fact all the advancements in the dyslexia and everything. Because back in when I went to school, maybe you too, they didn't identify a lot of stuff like learning issues. They just put you at the end of the hallway in that classroom with the construction paper over the window, and they were like, "They'll figure it out eventually." I don't know.
Well, it's interesting because what Dr. Conway was talking about, so much of it has to do with the very thing that you use to build your jokes and the cadence. So, real quickly, just some background. You've been doing this for 15 years.
Yeah, 15 plus years. You were there at the beginning.
I was.
Yeah.
I was, and I have followed your career. Just to kind of set the stage, and you are a full-time comedian, but you also have a full-time job. I mean, are you okay? So, and how long have you been wearing those two wardrobes?
Probably the whole time, with the exception of 4 years when I was single. Okay. Right, and it was easier to be on the road all the time. And then I left. And I didn't leave comedy, but I started to go back to a day job to provide a little bit more stable income. Every comedian that you've never heard of knows that you have a great month, bad month, great month, with bookings and stuff. So I was like, let me make the best of both worlds while still providing stability for the family.
I don't know what the average length of a comedian's lifetime is.
Mhm.
I mean, you've been doing it 15 plus years.
Yeah.
I mean, no, it's way plus. It's got to be 20 plus.
Yeah,
now.
over 20.
So you've got that staying power, and you've also been able to work with the likes of the Jerry Seinfelds, Kevin James, Jackie Gleason. That's just crazy. So when you look at that, and you look at now you're touring with Howie Mandel, what does Danny look in the mirror and say to himself?
Always a bridesmaid. Never a bride.
But the bride's coming, right?
I think I love those opportunities. I would rather, because I don't always get to do those big theaters like that. So when I get to work with these celebrity types and travel with them and connect with them, first of all, it's a great experience show-wise.
Yeah.
1,000, 2,000 people. And then, when I kind of go off on my own and do my own thing, it's also pleasurable, but I'll never pass up an opportunity like that.
What do you learn from those experiences?
Well, it's fun to watch them because typically I've seen them when I was a kid on HBO special or whatever kind of comedy special they've had, and then I get to sit stage side and watch them work. And I'm at the point now in my career where I'm comfortable enough to kind of I talk shop with them, give them a line. They might give me a line for their act and kind of just banter a little bit like that. But to watch them, I learned a lot on how to, if I'm performing in front of 100 people, it's much different than 1,000. Timing, sound, cadence, takes longer for the laughs to stop or, receive it. So you have to change your pace.
Mike Freed, who we both know, kept comedy alive in many ways, by really building a community and having gone to so many different local comedy shows. It really does seem there is a fraternity/sorority, brotherhood, sisterhood. How do you find that changes, or does it change as you move up the ranks?
Well, I'm thankful for it in the sense that now in Jacksonville, you can perform at an open mic almost every night of the week somewhere in Jacksonville. When I started, and this from us doing those Monday night shows at the Zone, you were doing improv, I was doing stand-up first starting. It was that and maybe St. Augustine, there was a room. That was it. But now, when I need to go tune up material or I just got into the Nashville Comedy Festival. I was asked to be a part of the Nashville Comedy Festival. So I get to go whenever not whenever, but a lot of opportunities each night of the week to practice and fine-tune my stuff.
All right. The time always goes so fast.
It does.
We've only got about 40 seconds here. Real quickly, you're touring with Howie Mandel. What's that been like, and what's going on?
It's it just came to an end.
Right.
It's been phenomenal. He was super nice. Obviously OCD. I'm OCD. No handshaking, no nothing.
Right. Yeah.
I learned a lot. We connected, him and his team, and but yeah. Now next up for me in Jacksonville, you mind if I plug?
No, you got it. No, go real quick.
Breezy Jazz House, Breezy Jazz in San Marco, April 25th. I'll be there.
April 25th, Breezy Jazz.
Danny Johnson Comedy, all social media.
Okay. That sounds wonderful. Danny, gosh, I could do 10 hours with you.
I
buddy.
know. Thank you, sir.
That is our program. Thank you for listening. I mean, genuinely, if you have feedback or suggestions, you can send either to First Coast Connect at WJCT.org. If you missed anything during our rebroadcast at 8 o'clock tonight, you can also find our entire program on WJCT.org or your favorite podcast platform. Join us tomorrow when we discuss how changes to Medicaid could impact First Coast residents with disabilities. I'm Al Emmerich, and you've been listening to First Coast Connect on WJCT News 89.9.
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.
Baptist Health is a proud supporter of First Coast Connect. Baptist Health, committed to building a healthier community for all of us. More info at 202-4YOU or BaptistJax.com. The North Florida TPO is dedicated to transportation planning, funding, clean fuels, and new technologies for a vibrant, resilient, and connected region. More information available at northfloridatpo.com. Life South Community Blood Centers, providing blood and patient services to the local hospitals, serving patients in this community. Donating blood with Life South helps save lives. More at lifesouth.org to find a blood drive near you.